Good evening and welcome to Just the Facts, COVID-19 50 Plus edition. For this program, Black Doctor partnered with the AARP to talk about COVID and the vaccine's impact on the older members of our community. Tonight, we have assembled a panel of healthcare professionals to break down the virus, vaccines, and the treatments available. Also, we have representatives from organizations who are enacting real programs that are providing balance in the health equity equation. I am here now with Edna Kane Williams, who is an Executive Vice President and Chief Diversity Officer for the AARP. Welcome to the broadcast.
Thank you, Ellis. It's my pleasure to be here this evening. AARP is really honored to co-sponsor this program with Black doctors. We all know how prevalent the conversation is about COVID and vaccines today. There's not a day that goes by that someone asks me a question about when can I get it, where can I get it, should I get it? So AARP understands its responsibility to help educate, especially people over the age of 50, because this virus has been so impactful for our age group. We want to make sure that people have the resources and information. And I applaud the esteemed panel that we brought together this evening. They have been working really tirelessly. I've talked to each of them, and some of them have yet another event tonight because we all understand how important it is to prioritize pushing information out, especially honestly for the African American community. It's not an exaggeration to say we're in life or death times, that this virus has been very deadly for our community. We need to understand what's at stake. People need to make their own decisions about whether or not to take the vaccine, but we want to make sure that you have all the information that you need as you contemplate what to do next. So Ellis, I can't wait. I know that we have a lot to cover this evening, so I'm going to turn it back to you so that you can start to engage with our panelists.
Well, if that's how we're starting, we're going to have a wonderful, wonderful program tonight. Thank you so much for those wonderful comments, Ms. Williams. And we look forward to talking with you a little bit more about what AARP is doing to fight COVID a little bit later in the broadcast. So I do want to say that we had scheduled to have Dr. Fauci appear and answer questions, but he had a scheduling conflict that prevented his participation. However, I will say I've had the pleasure of interviewing the chair of the Biden Task Force for Health Equity and talk about the latest updates on the vaccine rollout and specifically the impact it has had on Black Americans 50 and older. So Dr. Nunez-Smith's video is coming up. Good evening. And I am here to introduce Dr. Marcella Nunez-Smith, who is the chair of the COVID-19 Health Equity Task Force and quite possibly the hardest working health professional in the country right now. I want to say welcome again and thank you for joining us, Dr. Are you kidding me? Marcella Nunez-Smith.
Thank you. It's great to be here. So good to see you, Alan.
Real quick, as we begin, could you give us a brief update in terms of where we are with the vaccine rollout and how close are we? Are we getting closer to that wonderful euphoric state of normal life? How close are we and where are we in terms of the vaccine rollout?
Yeah, absolutely. Happy to provide an update. We always say it's not vaccines, of course, that save lives, it's vaccinations. And we're really grateful in this country to have 3 vaccines for authorized emergency use. And so what we need to be working on, of course, is the vaccination and the vaccination campaign. President Biden said he was going to get us to 100 million vaccinations in 100 days, and we did it, and we did it early. And so it's really very, very encouraging. It's great news. Right now we're averaging above 2 million vaccinations a day. This is due to the hard work of lots of folks at the federal government, state and local health officials, providers, everybody on the front line, just people really getting out and getting people vaccinated. So it has definitely been a group effort, but I say that it's under the really quite wise leadership of the president, who said we need to make this a priority and get this done.
Absolutely. Well, that is very encouraging news to hear. I'm so glad that we're getting, God, that's a lot of vaccinations done each day. And so we're getting closer and closer to what our new normal would be, because we understand that this is not going to go away. But just happy to hear those latest updates. Thank you for that. Also, I noticed that on the CDC latest numbers on their website that the largest number of individuals that are being vaccinated are above the age of 50. Was this the original plan, and how encouraged are you to hear those numbers?
Extremely encouraged to see those numbers. We have to prioritize older adults. We knew this from the beginning. When we talk about COVID-19 and its disproportionate impact, we sometimes forget to start with older adults, who has faced really the greatest burden, particularly when it comes to severe illness, hospitalization, and loss of life. It's been older adults. And so this is absolutely the design. Everybody wants to make sure that those people most at risk for the worst outcomes from COVID-19 get vaccinated first. And so we are very encouraged to see older adults in the country getting vaccinated, as you said, all of us on the road to the new normal.
Absolutely. So we've been hearing a lot about the vaccine supply recently, especially as we added, the Johnson & Johnson vaccine, and particularly leading up to May 1st. So it's a two-part question. First, what is the significance of May 1st, and how can we get seniors and their family members vaccinated?
Absolutely. So, President Biden issued a charge and said we really need to ramp up supply. That's what we saw early on. There was demand out there, and there were people who really were eligible or should be eligible for vaccination, and there just wasn't enough vaccine supply. And put the administration to work, really ranging from things like using the Defense Production Act right through to brokering historic deals. We see Johnson & Johnson and Merck coming together to increase supply. So at the end of the day, what it means is we will have enough vaccine supply by the end of May for every adult in the entire country. Vaccinating a country is not a small job. It is gargantuan. But having that supply and that ready supply chain is key, and being able to let states and locals know really what's coming in terms of their supply is going to be critical for the planning and for everything else. And so, that is huge. And with that reality, the president called on governors to say, look, by May 1st, let everybody be eligible so people can get signed up and get in queue for their vaccine. And that leads right into that second question, which is, how do people connect with vaccine? So I would start by saying that, the majority of vaccine allocations go directly to states and local municipalities, as well as tribes and territories. And so you really should check with your local health department first, or your state. But in addition to the work of the states, there are several federal vaccination programs we've stood up to serve in partnership with the states. And so we are expanding, for example, our retail pharmacy program up to over 20,000 pharmacies in the country. So be sure to check with your local pharmacy. We're working with both chain and independent pharmacies. Your pharmacy may be carrying that vaccine through one of the federal programs. In addition, we've also stood up partnerships with community health centers, and many, many older adults get their care at community health centers. So check with your community health center. And of course, the federal government is standing up larger mass vaccination sites around the country. Many of those also have mobile units, and they're working very closely with community-based organizations, the faith leaders, and others to help connect people with vaccines.
Absolutely, absolutely. Well, that is wonderful, wonderful news. And so I'm going to ask the question that you get every single day. Can people trust that these vaccines are safe?
Yeah, no, thank you. I do get asked that question every single day, and I think with good reason. People have questions, and it's wonderful to have a platform like this, and I thank you again for it, to be able to give people that information and the answers to their questions. We're always here to meet people where they are in this. So I'll start off by talking about, do the vaccines work? And the answer is absolutely they work. All 3 vaccines authorized for emergency use prevent the things we care about the most: serious illness, hospitalization, and death. And unfortunately, those are the things that we have seen higher rates of in older adults. So really just key to know that those vaccines work. And then the question of safety. Going back to the top of our conversation, we are now past 100 million shots. So millions and millions and millions of people in our country have received the vaccine, and it's been proven to be safe. And keeping in mind too that the process that got us to here, very transparent. The FDA looks at safety as well as efficacy, how well it works, before making any decisions about emergency use. So you should have trust in the processes that got us here, in the scientists that got us here, diverse all, the clinical trial participants. I'm grateful to them as well, diverse and representation throughout. So important to understand that. And then to know that every day we're getting more evidence as more and more people get vaccinated. So yes, they are safe and they work.
Well, great. All right. So now that we know that they're safe and they work, which vaccine should seniors get, or are all equally effective for them to take?
Yeah, absolutely. So the vaccine that you should take is the one that's available to you. Again, we see that all three are highly, highly, highly efficacious. Again, at serious illness, hospitalization, and death, preventing those. And so, we understand there are some differences. I'm sure people have heard the Pfizer, Moderna vaccines, for example, require 2 visits and 2 shots. The Johnson & Johnson vaccine requires 1. And there might be different reasons why people have a preference for one or the other. I really encourage you, though, that if you are going to sort of shop around, you might end up having to wait. And every day that you remain vulnerable and exposed to the risk of getting COVID-19 is just a gamble you do not need to take. So I encourage everyone to take the vaccine that is available and offered to you.
What are some of the things that the administration is doing to get more seniors vaccinated?
Yeah, definitely. This is such high priority for the administration to make sure that people who are eligible are at yes, don't have any trouble finding and getting connected to vaccine. So the Administration for Community Living, people may know it as ACL, they're at the U.S. Department of Health and Human Services. They have been funding aging networks on the ground to assist older adults with vaccine access. So think about things like help with registration, providing transportation if needed, on-site assistance. Many of these networks are working with public health officials, setting up vaccine clinics just for older adults, and making sure that if people need mobile vaccination, that we also can help with that. So let me give you the national call-in line. This is the elder care locator that will help older adults register and connect with any support you need for access. That's 1-800-677-116. So 1-800-677-116. Or you can go to eldercare.acl.gov. Plus, the president announced there'll be a national website and call center coming soon, being set up to find even additional ways to help people get registered.
Absolutely. And I'm going to let you go with this question. What are some things that vaccinated seniors could do to help encourage their peers to go and get vaccinated if they haven't been already?
Yeah, this is the most powerful message. Kind of people who have been vaccinated going and telling their friends, their families, their neighbors, their communities, how important it is to get vaccinated. So please spread the word. Let people know what your vaccination experience was. I got vaccinated, and I tell everyone, after my first dose, I had a sore arm. We expect that. And after my second dose, again, as expected, very mild flu-like symptoms. I took some Tylenol and I felt fine within a day. But talk about that and talk about the experience that you have had and now what you are excited about doing, that you've hugged your grandchild, right? This is huge. All the things that we're going to get to reclaim, right, as we move forward together, whether that's worshiping together in person, going to sports events and games together, just really gathering with our family and friends. So share your vaccination experience, please. And again, go ahead and get vaccinated. The vaccine that's available to you is the best one for you.
Absolutely. Well, we want to thank you for giving us 10 minutes of your time. I know how busy you are. And thank you again for showing up here on blackdoctor.org and partnering with the AARP for giving our seniors some information that they need to not only if they haven't been vaccinated, to go get vaccinated, and to also help and share it with their peers and family members to go get vaccinated. So again, thank you, Dr. Marcella Nunez-Smith.
Thank you. Be well, everybody.
And that was our interview with Dr. Marcela Nunez-Smith. I noticed that she missed a digit, so it's an extra one in there. It's 1116. So for those of you that are watching with us live, the last four are 1116. So that's the final four. So thank you all for that. And she gave some wonderful information about the safety of the vaccine. And so now I want to bring on two physicians that will help us learn more about the vaccines and the treatments that are available. So I'm going to bring on Dr. Oliver Brooks, who is a past president of the National Medical Association and is currently the chief medical officer at Watts Healthcare in Los Angeles, and Dr. Jihan El Bayoumi, also affectionately known as Dr. Gigi, who is the founder of the Rodham Institute at George Washington University in Washington, D.C. Dr. Gigi and Dr. Brooks, welcome to the program.
Good evening. Thank you. It's always a pleasure, Mr. Ellis.
I always love seeing your faces. So let me ask you the first question. That is the question that I asked Dr. Nunez-Smith, the question that we get asked on every one of these programs. Is the vaccine safe? Dr. Brooks?
So I think she said something very important. We've hit 100 million doses administered. And we have not seen any significant variation from what we thought we would see. In other words, we know that there'll be some side effects. So the studies went in and said that it was safe, but now there's called phase 4, which is after vaccines are out or medications. Also, you also monitor them. So what we have found is that the 3 vaccines presently on the market, certainly the 2 mRNA vaccines, which have been out longer, and now the J&J single-dose vaccine, are safe and effective. So there is, generally speaking, other than very specific situations, no reason not to get vaccinated.
Dr. Gigi?
Yeah, I mean, I think, there's so much on social media. I don't know about you, but I'm an AARP member, so I don't really pay very much attention. But there is a lot of just disinformation, misinformation, myths, and the vaccines are exceedingly safe. And I want to just point out, for those of us above 55, we are less likely to have some of the side effects. We are less likely to have the high fevers or even the shaking chills that sometimes people have, or the body aches, or some of the GI distress. Sometimes people can get an upset stomach or even diarrhea. We tend to see that. I tend to see that as a general internist more in my younger patients. That's not to say that older people can't get that. My mother, who was 80, was having shaking chills and low-grade fevers. But the important thing to know about side effects, a side effect is not the same as a reaction. Because let's use a different example. Let's use an example of an antibiotic. Many people have penicillin allergies, right? They get a rash when they take penicillin. That is a reaction. But if somebody takes penicillin and feels sick to their stomach, that is not a reaction. That's a side effect. So those are two very important points, because a lot of people, actually the majority of people, will have some kind of side effect. Some as minor as arm soreness or, just feeling tired afterwards. But in terms of true allergic reactions, those are very, very, very low. And actually, I would even venture to say that given the volume of vaccines that have been given, these are certainly just as safe as the flu vaccines that we give every year. And I think that's a really important point. I'm trying to get my cat out of the camera lens. Sorry. I'm just keeping it real here.
Yeah, it's fun.
Dr. Nunez-Smith made a very important point, and that is getting back to our lives. I don't know about you, but I don't want to be at home all the time with my cats. I'm not going to be the cat lady. I mean, I love them and all, but I want to be able to get out already, right?
Absolutely. So in that, and you did a great job kind of talking about the side effects. So Dr. Brooks, I'll ask you, which vaccine is the best to take?
Dr. Nunez-Smith already addressed that, which is the one that you can get in your arm first. That's your perspective. Now, from our perspective, there may be some benefits to the Johnson & Johnson vaccine. And by that, I mean, as most know, it is a one-dose vaccine. So as a provider, as one who has the provision of giving vaccines, there may be certain populations where the Johnson & Johnson is better. And this is because you can get one dose versus two. In terms of safety and efficacy, no difference. But transient populations, people that are needle phobic, people that have difficulty with transportation, those that feel that, one shot, I want one and done. And so one of the things we say, the J&J would be better for someone who says, I prefer that vaccine. But as it relates to the person, the sooner you get vaccinated, the better. So I would not slow or halt getting vaccinated or delay getting vaccinated because I was waiting for a particular vaccine. Because remember, there's a concept in the immunization field called immunization or vaccine delay. So every day you're not fully vaccinated is the day you're at risk for getting COVID-19, which you don't want to get. And I'm gonna just add one little point that Dr. Gigi didn't say. There is a side effect of not getting vaccinated.
Mm-hmm.
That side effect is COVID-19, illness, hospitalization, and death.
Wow.
So not getting vaccinated is an active decision. People think of it as being passive. Well, I just didn't get vaccinated.
Mm-hmm.
That was an active decision that puts you at risk and others at risk.
Wow. Well, I think that's so important, Dr. Brooks. I'm going to add that because you're right. The side effect of death of not doing something is so important. And I think so many patients tend to think of this, or individuals, as though this is passive. But Mr. Ellis, I want to share something that one of my colleagues from the Black Coalition Against COVID, Dr. Melissa Clark, gave me as an example. And that is when you're infected, or when an individual is infected with the COVID virus, it turns the body into a COVID manufacturing plant. And it just keeps, making more and more and more virus, which then means that it can more easily spread. People who are not getting vaccinated, for every day that they're not vaccinated, the virus is getting more and more and more numerous, more and more people are spreading it. So it's much better to get vaccinated, to get those numbers down in the population so that all of us can feel safer. Because guess what? There are going to be a few people that cannot get the vaccine. Those are the people who are, those are the people who have allergic reactions to vaccines, meaning they become swollen, can't breathe. Those people cannot get the vaccine. And so for their sake, we need to vaccinate ourselves so that they can be protected.
Thank you for that. And that's a great way to kind of explain it for us lay people, is that we're virus factories. So I guess the question for you, Dr. Brooks, is, does the vaccine contain any piece of antibodies from the virus itself?
No, it does not. And I think it is important for those who have that concern or any concern regarding the content of the vaccine to understand it. The messenger RNA vaccines, the Moderna and the Pfizer BioNTech, they have a small piece of messenger RNA, which is basically a compound or molecule that makes your body make a protein. So that's what is in that particular vaccine as it relates to how active it works. So it makes a particular protein that your body views as a foreign object. Hence, it develops antibodies or an antibody or immune response. Then when the virus comes along, and that by the way, that protein is a component of the virus that allows the virus to hurt you. So when the virus comes along, here's the virus with its spike antibodies, which are shaped like a Y. They connect to that part and they just block it from working. The J&J vaccine does it slightly differently. They actually have that protein there. The body, in a harmless fashion, the body develops these antibodies. So then when the virus comes along, the bad guy that's ready to punch you with its spike protein out, your antibodies just connect to that spike and they block it. So no, this is how they work, and there is no component like that in the vaccine. Nothing that is the virus itself. It's like a picture of the virus is the way I look at it.
So the only two live viruses that exist are the polio virus and the yellow fever virus. Okay, vaccines. I'm sorry, the polio vaccine and the yellow fever vaccine. All the other virus technologies do not use live virus.
Okay, that's good to know. So for this population, especially many AARP population members have comorbid conditions, hypertension, diabetes. I know my mother takes her pills in the morning for high blood pressure, and she's got hypercholesterol as well. And so will this vaccine interfere in any way with any other medications that people might be taking now?
No, there's no evidence to show that. The people that were in the studies, to my knowledge, were told to continue what other medications they were on. And a good proportion of those in all three studies were seniors. So no, and generally speaking, it's interesting we have all these questions about this particular vaccine, but we have, dozens of vaccines. And generally speaking, there's been nothing in any of those vaccines where there was an effect on the fact that you were taking blood pressure medicine, high cholesterol medicine, diabetes medicine, medicine for osteoarthritis that led to any problem. So no, keep taking your medicines. If you have any real worry or something, ask your doctor. But I can tell you pretty comfortably that you don't have to worry about taking your medicines and getting vaccinated.
So, Dr. Gigi,
you know,
I'm going to ask you this real quick because I know we're coming up on our time, and I know I want to get these questions in from our members. Why does the virus tend to have a higher and more adverse effect on the African American population?
Great question. It's the same reason that African Americans have the higher death rates in cancer, in diabetes, in just about every other illness. Sometimes people want to attribute that to genetics, but really it's the structural and social determinants of health. Both Dr. Brooks and I think what we do for a living as doctors is very important, but guess what? We only account for about 20% of a person's life expectancy. In other words, 80% of what goes into predicting how long you're going to live has to do with the zip code that you are born into, your education, the food that you eat, the water you drink, the air that you breathe, as well as the economic health of the neighborhood where you live, among other things, not to mention racism, et cetera, et cetera. So it's no different than with any other illness. So if anybody wants to tell you that somehow African Americans or people of African descent are more susceptible to dying, well, yes, they are, but it's not because of the genetic reasons. It's because of all these other factors.
Absolutely, absolutely. So, Dr. Brooks, do you know if there have been any report? I know this is hard, but this is one of the questions that people want to know is like, have there any implications of a long-term effect in terms of after getting vaccinated? Like, because
Right.
I know vaccine people are concerned about how quickly the vaccine was developed. So we haven't had a longitudinal kind of understanding of the effects on the body. So what can you say to assuage some of those concerns?
So most of the problems that happen post-vaccination with other vaccines happen within the first 6 weeks. We generally don't see a lot of issue going months or years out. That being said, I think it is a legitimate concern. This vaccine will be studied. Those in the study, clinical trials are going out 2 years. I mean, that doesn't help you a lot right now, but going out 2 years. I am not really that worried about a long-term side effect. Again, you can't know. One thing I will say is that these vaccines were developed in a shorter period of time, but there were a couple of reasons for it. I think that's really important. Number one, probably the most important thing is the government said, we'll buy all your vaccine from you, whether it works or not. So they could manufacture a vaccine, whether it was efficacious and safe or not. So that cut off years, because once vaccines get developed, it takes a couple of years before you can make enough, market it, and get it out. And then they did phase 1, phase 2, and phase 3, kind of layering one on the other as opposed to doing them sequentially. And I want to add one other thing to that. I'm glad they did that, because let's say it did take 3 to 5 years to get this vaccine out. So we'd have 1.5 million, 2 million, 3 million people that are dead. So in summary, generally speaking, vaccines, we don't see long-term effects. Uh, the vaccine is a messenger RNA. It's a clean, the two or the three are, it's a clean, it's a little piece of mRNA. There's really, quite frankly, not a lot it can do to you. And that was because I had that same concern. But when I started looking at the science and looking at the molecules and looking how it was structured, and then looking at other vaccines for the J&J, because that adenovirus platform from which it is made has been used, I think, maybe 10 different vaccines. So looking at them and being objective and understanding that I got vaccinated myself and I'm as concerned as anyone else, for those reasons, I feel very comfortable about having any concern regarding long-term side effects from the vaccines on the market presently.
Dr. Gigi, does the current vaccines offer any protection against the new variants that we're hearing about of COVID?
Those are excellent questions. We are getting the information. And I just want to say one thing. You know, the information that we're providing today is the best information that we have available today based on the science today. It may be in 3 months or 3 years, we will get more information that said, you know what we told you, we were giving you the best information, but it wasn't quite right. So that's one thing I think is very important. Tell me the question again, Ellis. I'm having a senior moment.
That's fine. That's fine.
Audience can relate.
We're asking about the effectiveness against the other strains of
Yes,
the
yes,
virus that you
yes.
discovered.
So let's talk about how the other strains develop. Remember how we were talking about the body becoming a COVID manufacturing plant?
Yes.
Well, when it's making more and more virus, remember when people first started eating McDonald's, how it was really good and then the quality kind of started to go down, right? Because the volume is such that quality can go down a little bit. Well, what happens is that the virus then has defects, right? And so most of the time that's not a big deal, except when the defects make it stronger, and then it's more infectious, can infect more people, or deadlier. Those are two things that we don't want. That's why vaccination, just getting the numbers down, is so key.
Right.
So we don't know. There is some data that indicates that there may be more protection with one of the vaccines, but these variations are coming up and will continue to increase as long as many people are out there infected with the virus, whether they know it or not. I don't know if Dr. Brooks has a better answer than that.
So what I do know is there is some cross-reactivity, as she stated, with some vaccines. What we find, and this is true with influenza, that even if the vaccine is not fully protective of, let's say, a variant, that if you get the variant, and we don't have a lot of data yet, but if you get the variant, if you happen to get the South Africa strain and you got vaccinated with Pfizer, Moderna, or J&J, you may have likely to have a milder case. So those that are worried about the variants are appropriately concerned, but that wouldn't stop me from getting vaccinated. So yes, there is some protection, but it's different with different strains and it's different with different vaccines. And I would not use that information to try to choose a vaccine, because what you see today may be different tomorrow. That's one thing to remember. Everything we're telling you today could change tomorrow in terms of certain aspects. A lot of this stuff is straight science, and we know, but this is a novel virus and we have to be prepared. But one thing that won't change is that you should get vaccinated as soon as possible with whatever vaccine is available to you.
Mm-hmm.
Absolutely, absolutely. Well, I could talk to both of you all night, and I'm sure we've got some great questions in our comment section, and we're going to try to get to them. So we're going to have a short Q&A section at the end of the broadcast. Hopefully, you'll be able to return. I know you've got some other obligations, Dr. Gigi, but hopefully, Dr. Brooks, you can hang around and we can answer a few more questions that people might be having regarding the vaccine.
Certainly.
Thank you, Mr. Ellis. Always great to see you.
Always. Wow, so that was some great information. So, but now we're going to continue on and get some more information. So my next guest is Mr. Carlos Cubilla, and he is the Senior Vice President and Global Chief Diversity Officer for WBA, and that is the parent company for Walgreens. So Mr. Cubilla, I'm going to bring him up here. Mr. Cubilla, welcome to the program. How are you?
I'm doing great, Ellis. Thanks for having me. How are you this evening?
I'm doing great. And we're getting some great information from Dr. Nunez-Smith. And then you just saw how Dr. Brooks and Dr. Gigi were just going back and forth, giving us some great information. But that's about the vaccine and the virus. but now we're really kind of talking about distribution, and that's where your company comes into play. And so how are Walgreens and the Black community working together to ensure equitable distribution of the vaccine?
Well, so first of all, again, thank you for this wonderful opportunity just to kind of share some of the things that Walgreens is doing and are continuing to do as it relates to getting this vaccine out into the community. To your question, partnerships is really going to be a major part of how we get the vaccine out into Black and Brown communities, specifically the African American community. As you heard from the good doctors that's already spoke thus far, the African American community has been disproportionately impacted by this pandemic, this COVID-19. So one of the things that we know is vaccines. Walgreens has been in the vaccine game for a long time, and we've delivered millions and millions of vaccines over a long period of time. This is a monumental task here because we are running into many different obstacles here that maybe we didn't face with others. One is the vaccine hesitancy, right? Folks not having the information, the data to make an informed decision on should they take the vaccine and is it safe and if is it effective? Well, we've heard from the experts already on this program, the safety and the efficacy of it. So what the partners that we have come together thus far, brought together thus far, will help us to do is get into the community, to educate the community, to be a trusted individual in the community, because sometimes it's not the message, it's the messenger. Who do you trust? Who do you have confidence in to bring this information to you so that you know that you're getting good updated information? So some of the examples of the partnerships that we've already formed is the National Coalition of 100 Black Women. Here locally in Chicago, the Chicago Urban League, the 100 Black Men of America, and those individuals help us to get into the community. We're also working with faith-based leaders to stand up clinics in the community. We were recently in Atlanta, Georgia. We stood up 3 churches, and in a 3.5-day period, we vaccinated over 7,000 individuals by working with the community and working with these partners. Another thing that we did is partner with Uber, because access and transportation is another barrier. So we work with Uber to make sure that we could provide transportation and give free rides to those individuals through these partnerships to get the individuals to the prescribed location so that they can get the vaccine.
That is amazing. That is very amazing. Because that was my next question. I was going to ask, if somebody is homebound, especially when we're talking about the senior communities, members of AARP, they might be homebound. They may not have transportation, reliable transportation. And so just to know that you're partnering with Uber to give, rides. So how can they access those Uber rides to be able to get that transportation?
So the way it worked in Atlanta, and it's an evolving program, but the way it worked in Atlanta is that we put Uber in touch with these community partners to provide special codes to connect with these individuals where the partners gave out the ride. So they gave them barcodes or special, oh God, I'm drawing a blank here, but in terms of connectivity, how to get to Uber, and these partners would set up the rides for these constituents to make sure that if you were in that community and you needed a ride, the partner, whether it was the church, the Urban League, or whichever partner that we've connected you with, they would have access to the platform so that they could schedule these rides for the individual to get to and from the clinic. The partnership with Uber is a major, we're they're an exclusive partner of ours in terms of this transportation that's being provided here. But other things that we're doing to work with the homebound or the folks that can't maybe make it to one of our locations is we're taking the vaccine to the communities. Those churches that we worked with in the Atlanta area, they were not in those vaccinations were not in our stores. We went to the community and we brought it out into the community to make sure that folks had access, and we helped to address the transportation issue as well as the location issue.
Wonderful. That's wonderful news to understand that corporate partners are coming together to go into the community to make sure that people get the vaccine so they can be safe. We've talked about this May 1st date, a couple of times, and so I think the question is, do you have any with the May 1st deadline? And for those who don't know, May 1st is when President Biden is saying that he's telling all the states that they can open it up to anybody. So there's not going to be any more, lists or eligibility requirements. It's going to be free for all. Anybody that wants a vaccine can get it. And so with that May 1st deadline coming, rapidly approaching, do you think it'll be more of a challenge for the 50 plus community, for seniors in the community to get vaccines? And so you think it's more important for seniors to get vaccinated now before that date?
Well, I think the important thing to understand here is that thus far, since the vaccine has been available, it has been really concentrated on the senior population, long-term care facility, assisted living facilities, and folks with comorbidity. So to date, that has been the focus community. So I won't say we're 100% confident, but we're pretty confident, and as well with the Biden administration, that they're pretty far along in vaccinating that vulnerable population. Now, are there going to be some stragglers that are still going to need to get out there? Yes, but based on what the administration has put out there, by May 1st and by the end of May, that there will be enough vaccination for everyone that wants one in the country. Right. So while what I'll say is the seniors have gotten a head start, and we've probably got a wide swath already vaccinated, either with the first or the second dose. But as we get to May 1st and beyond, I think that through the partnerships, through the availability, the expanded availability of the vaccine, that population will be fine.
Absolutely. So I'm going to ask you a question about, are you noticing, or are y'all keeping data in your stores about from your pharmacists there? Are they noticing a large number of Black Americans coming in to get vaccinated, or are you finding that you're vaccinating more Black Americans in your community outreach programs?
Well, so to your question, and so I'm not a pharmacist, as you know, so I'm not in the stores every day, but what I am is I'm in the community and working in these community clinics, and we're targeting this population to make sure that they have access to the vaccine. So as I mentioned to you about what we did in Atlanta, we've had other clinics that we've stood up across the country. We're going to be standing up a lot more. For example, we're getting ready to do something very similar here in Chicago, then in El Paso, Houston, Milwaukee. So we're targeting these communities, and we are tracking that information to make sure that when we talk about equity and access, that we are actually not just talking the talk, but we're walking the walk.
Well, absolutely.
So yeah, we're pretty confident in that area.
No, I am too. I mean, I'm feeling way more confident now with your ability to get equity, because I know that's been a big push for you and your role there at Walgreens and WBA. And so we want to thank you for your efforts and the company's efforts. And so we may have a couple more questions for you at the end, so just kind of hang around here, and we're going to continue on in our program. And I'd like to bring on Dr. Reed Tuckson, and he is the co-founder of the Black Coalition Against COVID. He has done a great many things, and you all have seen him on Black Doctor Facebook Lives many times, and he is working diligently and tirelessly to get this information out about COVID and the vaccine. So thank you for joining us this evening, Dr. Tuckson.
Thank you for having me. Appreciate it.
So I'm going to ask the simple question in the beginning, because I know we've been saying the name a lot, but what is the Black Coalition Against COVID?
The Black Coalition Against COVID is really two things. Number one, it is a community-based grassroots initiative in the District of Columbia, Washington, D.C., that is engaging community leaders across the breadth and depth of the city. We've learned a lot that is so important when you're trying to fight a pandemic like this. I learned this when I was health commissioner in D.C. during the height of the AIDS epidemic in the 80s, that you need community engagement to partner with government, that it's the community that has to fight it as much as it is the institutions of our society. And so we are very much that. We're also, though, a national initiative that has brought together our 4 historically Black medical schools, Howard, Morehouse, Meharry, and Charles Drew in Los Angeles, along with the National Medical Association, the National Black Nurses Association, and also we partner with the National Urban League and blackdoctor.org. All of us together are mounting an effort to provide trustworthy information from trustworthy people. And of course, we do understand that the Black community has a special relationship with its healthcare professionals. The Black health professional has been there for us always, and especially when no one else was. We've taken care of our own, and we are taking that mission and that ethic and that history with us today. And we are very much engaged now in working with you at BDO and many other places to provide this kind of trusted scientific-based information that our community can rely upon, that they can believe in, and that they can follow in ways that will help them make the right decisions for themselves, for their families, and for the communities in which we live.
Well, that is wonderful, and I'm glad we had the opportunity to really kind of explain what the BCAC is. I know we've been hearing it a lot, and the presence is growing nationwide, but we really want to get people to understand what this organization is doing. So, as one of its leaders, you have some keen insights. If you've been listening to the communities, you've been putting on these programs and making a plain program here on blackdoctor.org, you have some keen insights in terms of Black community and coronavirus and the vaccines. What are some of your concerns? And also, what are some things that you're optimistic about as we talk about vaccines going forward?
I think my major concern, Ellis, is that people will start to think that we've won the race before we've crossed the finish line. It's almost like that we laugh when the football player prances his way towards the end zone, styling and profiling, and then drops the ball at the 5-yard line, and the other team grabs it and runs it back for a touchdown. There are many of our people in this country and many governors of our states who are doing just that, prancing towards the goal line and then dropping the ball. These variants that have been talked about so often on this program so far are serious. They are more dangerous. They spread more easily, and they are now becoming the dominant strain of the virus in the United States. I'm very worried about that because there are too many people who are deciding that they can stop wearing their masks. There are clearly a whole cadre of Americans who are no longer following social distancing. The traffic at the airports is at an all-time high since we've been in the pandemic. People are just deciding that they've had enough. And even though we're so close to the finish line, there are a lot of people who just, quit the race. And so I'm very worried about that. I'm optimistic, though, by the numbers of people of color who have decided that they do want the vaccine, or at least that they want more information from shows like this to make a decision. We were seeing through our polling with blackdoctor.org that a few months ago, we were close to 70% of people who were unwilling to take the vaccine who are African American. And now we're seeing that number below 30%. And so we are really seeing a flip-flop. What is the good news in that is also, though, unfortunately, Ellis, combined with some bad news. And that bad news is that right now, with vaccine supplies being still relatively low, the demand is higher than our supply. And there are many people who are becoming frustrated. And I'm kind of sad that they are frustrated because we really want to get them vaccinated. But at the end of the day, if you're somebody that's trying to get vaccinated, hold on, because as you've heard from Dr. Marcella Nunez-Smith, supplies are opening up, and we will eventually have the manufacturing producing the supplies that we need. So when it's your turn or when you get a chance, get it. And please, please work hard to make sure that you are in line for it.
Absolutely, absolutely. I'm going to ask you, because I know you've got other commitments tonight, so I'm going to ask you one more question, and then we can let you go. Is that what can Black Americans 50 and over do to help the coalition in their effort to combat COVID?
I think the most important thing that you can do if you're 50 and older is to talk to your family and say to your family, I want to have Thanksgiving this year. I want to watch my granddaughter graduate in person. I want my granddaughter to be able to wear her ball gown and be able to go to the prom. I want my son to be able to go out and do the sports. And I want to be in the stands and watch him with a full stands of people cheering them on. My point being this: we need to be concerned and talking to each other about family. This is about family. And we need to say to our younger children, to our siblings, to everyone in our family, this is the time to put family first. And the way you put family first is to get vaccinated so that we can go back and do the things we need to do to not only enjoy our family, but to preserve our family. And so I would urge folk, please get involved in a conversation. And for those who are unwilling or who have questions, remind them what we have been saying throughout this entire show. It is okay to have questions. But the issue is not to stop with the question and then give up. Go to BDO. look at the evidence-based science that is there, and then make intelligent decisions. This is about family.
Absolutely. Well, thank you so much for that. And you're absolutely right. This is about family, and BDO, we consider you family, Dr. Tuckson. So we're going to let you go and let you go on to your other commitments in this fight against COVID. Thank you so much.
It's been an honor. Thank you. Okay.
At this point, I'd like to bring back Edna Kane-Williams. She is the Executive Vice President and the Chief Diversity Officer for the AARP to talk about her organization's fight against COVID. Welcome back, Ms. Williams. You're on mute there. It happens to us all.
Yes, it does. As many of these I do in a day, I still forget. So apologies.
No worries, no worries. So my first question is, what is the one thing that you want the 50+ population to know about COVID and the vaccination process?
Well, listening to the experts that we've had on this show and listening to the science points that are made, AARP, we're in the business of educating. We can't decide for people. We aren't even directing people. We're asking them to listen, to educate themselves, to make individual decisions, but understand how important this and how dangerous this vaccine is, and what the available vaccines can do for you and your family. So it's not my role to say you must be vaccinated. AARP does not take the position of directing healthcare decisions. We're trying to provide the best information, the best education possible so people can make the informed decisions. And I think clearly what we've heard this evening is that the science is sound, the vaccines are safe, and that the vaccines are an important step towards regaining our lifestyles that we all miss so much.
What are some of the things that the AARP is doing to ensure that their membership has the most up-to-date information? I know this program is one of them, but what are some of the other things that you're doing to ensure that your membership has the most up-to-date information?
Sure. And one, I want to point out, this is one program. We've had hundreds, literally hundreds of these types of webinars and teletown halls and Facebook Live events. Really, since the pandemic started, we have been constantly interacting with our membership and non-membership, because this isn't a membership issue. This is something that affects all Americans, and we want to be available to all Americans to provide information and to answer questions. So we have been actively working with partners like blackdoctor.org. We've been working with churches. We've been working with civic groups. We've been working with sororities and fraternities. My department in particular is very focused on multicultural communities, making sure they have all the information that they need. We have really expanded our reach and has done everything that we can to make sure that 24/7, really, if you want information, you have access to it. I do want to tell people about aarp.org/coronavirus is our online center for coronavirus information. And importantly, it has state-by-state information. So it has general information, but also state-by-state in terms of vaccine availability, understanding what initiatives and what partners are engaged, detailed information about the science in layman's terms. We've had a lot of doctors who I thought did an excellent job of keeping the terminology simple so that we as lay people can understand. But it's hard to catch everything in this kind of environment. You need to have something printed that you can sit and read and digest. So all of that kind of information is on our Coronavirus Information Center. Again, aarp.org/coronavirus. I encourage everyone to visit that site and avail themselves of the information there.
And that's great. So it's aarp.org/coronavirus.
Yes.
Absolutely. So as we mentioned earlier, right now, the top number of people that are being vaccinated are 50 and up. Mm-hmm. How encouraged are you by this number?
I'm encouraged. I do, as Dr. Tuckson mentioned during his remark, there is still they're not sufficient numbers of African American older adults. There's still disparities in terms of the distribution and the access. I think they're getting better. I think all of the partnerships and what Walgreens is doing and other pharmacies, the mass vaccination sites, it's helping. But even as recently as a month ago, there were great disparities between who was getting the virus, who over the age of 50, who over the age of 60, 65 was getting the virus. So I like Dr. Tuckson's analogy about football. I think we're almost close to the finish line in terms of evening out and making sure that there aren't disparities in the distribution channel. But I think we have to keep our eyes on the prize, in winning the race. I'm not a sports person, as you can tell, but I don't want to say that all of the disparity issues have been fixed. I think we still need to focus on that. I think states and localities and these kind of partnerships, showing up in African American communities, showing up in North Philadelphia, showing up in Anacostia, mobile sites, people who are homebound. I think the Uber partnership is great, but it may not affect and reach everyone. So we really still have to make sure that all of the folks of age in African American, Black and Brown communities that want the vaccine can receive it. So good news, yes, and improving news, yes, but the job is not quite done just yet.
Absolutely, absolutely. That's why we're here, and we're going to continue to be here. So I guess the question is, how can those that are over 50 help their peers? If you've been vaccinated, you're over 50, how can they help their peers and encourage their peers to go get vaccinated?
Well, I think Dr. Toxin, again, highlighted and answered this, talk to people. And I love that someone, I think it was Dr. Gigi, who talked about the side effects and what you experienced, how long was the wait, where did you go? I think talking about the fact that you have been vaccinated, and yes, you might have had some transitory side effects, but you're fine. People, to demystify it, we need to talk about our experiences. Again, I mentioned that AARP, we respect this is a healthcare decision. So really, you can only make that decision. It's not for me to tell you, oh, you have to do this. But it is incumbent upon us to share our experiences and help educate people so that they can make the best decision for themselves.
Absolutely. So what can we do to and the 50 plus crowd, what can they do to help the younger members of their family understand? Because we can all go get it. If everybody over 51 got vaccinated, we would still not have reached herd immunity. So how can the 50 plus community help their younger family members, their nephews, their nieces, their sons, their daughters, their grandchildren get vaccinated so we all can live a better life?
Mm-hmm. And it's interesting that you bring this up. I have not seen the research, but I was talking to one of our faith-based partners last week, and they said in their experience in talking to people about their willingness to take the vaccine, they were seeing more hesitancy in younger populations as opposed to older adults who were ready and willing and just frustrated that they couldn't get it. So I think that's another part of the race that we're in, that we can't announce premature success, because we are seeing these pockets of hesitancy and people outright saying, no, I'm not going to get the vaccine. And again, whether that's a young person or an old person, the key is still talking and sharing and while letting people know what your experience is, why you think it's important, directing them to resources like this program, like our websites. People are different. Some people, you could talk to them, forever, and it's like, that's what you think. I'm still going to, believe what I think. But providing access to information that's non-biased, that's clear, that's concise, and allowing people to make their own decisions, I think ultimately will win the day. But a key part of that is talking and sharing with people what you found, what resources have been helpful to you, talking about how you made the decision. How did you come to decide to be vaccinated? Well, I did these 4 things. Share those 4 things and let people decide for themselves.
Right. Well, there was some things that I did, even with my own family. We have our little family Facebook group that we share information, and I drop a line every once in a while. I don't inundate them with the stuff, but I drop a line every once in a while, and I want to give them the most up-to-date information. So if there is a little off, and I would, encourage people to do that. If you have a Facebook group, if you've got a family group, whatever, just mention it. send a link to this program, give them the AARP link. And so, because that information is valid, not just for the 50 plus, it's valid for everybody when we're talking about the vaccines. And so don't just feel like, hey, I'm not 50. I can't utilize that information. That information is good and valid for everybody. So, so thank you all. Thank you for what you are doing. Thank you for the AARP. Thank you so much. I want to get that in there now as we move on. Because I'm going to bring back Dr. Brooks here because there were some more questions from your population. I think the AARP did a wonderful, wonderful job in terms of being reaching out and asking their populations questions that they would like to have asked on this panel tonight. And so, Dr. Brooks, you're on the hot seat because Dr. Tux and Dr. Chichi had to go. But here's an easy question, and not an easy question, but just a question. The first question is, if someone is fully vaccinated, what precautions should they take around unvaccinated people?
Okay, so first I want to comment on Mr. Cubia and the work that Walgreens is doing, because a vaccine is useless in a refrigerator. So if you get it out of the refrigerators and into people via a vehicle such as Walgreens, that's crucially important. And number two, what the AARP are doing, what Ms. Williams' group is doing, educating people to make them have more information, give them more information. Again, as important as it is that these scientists got these great vaccines, what those two are doing, AARP and Walgreens, is crucially important. Now, as well as, okay, if you are vaccinated, you can be around other people that are vaccinated without social distancing, without a mask. I'm still a little leery of that, but that's the CDC guidance. You can go into a household of unvaccinated, low-risk individuals, okay? And you can not go into quarantine if you're exposed. So if your friends came over, you found out one of them got COVID 3 days later, if you're fully vaccinated, you don't have to go into quarantine. And what do you have to continue to do even if you're vaccinated, which was the question? First of all, if you go to any medium or large gathering of individuals, you still have to practice masking, social distancing, etc. If you develop COVID-19 symptoms, you still need to get tested. So those are some of the things that you still need to do, even when you're fully vaccinated.
You know, Carlos, one of the things that was brought to our attention, and we've seen in the news sometimes, is called line jumping. And we noticed that people in the Black community are hesitant to go into other communities, but other communities have not been hesitant in terms of going into Black and brown communities to get vaccinated. How open is Walgreens to people coming in and just trying or getting themselves on the waiting list to get vaccinated?
Well, so we are open to making sure that everybody that has access that's eligible for the vaccine, right? Okay. So we don't turn someone away and say, you can't come here and sign up for the vaccination. Right. We don't do that. So if you're eligible and you meet the criteria that's been set by either the state, the federal government, or whoever's in control at that time of that particular stage, we'll honor that and we'll make those vaccines available. But again, what we are trying to do in these communities is make sure that the folks that live in those communities and that are at risk have access, whether, let's say they don't have the technology. We've opened up our stores where you can go in and make a appointment. You can call and make an appointment. We've done outreach into the communities and called some of our patients and customers and said, hey, you're eligible. We can make an appointment for you. So we've done outreach and we've opened up other avenues for folks to come in and take to get registered to get the vaccine. So that's kind of how we're approaching it.
Absolutely, and that's the best way to approach it. People, there are resources there available to you, whether you're online or not. You can make a call. You can go into the store, get registered, whatever you need to do into your community. And if there is some concern about other communities coming to our communities because there are vaccine appointments available. And that means we've got to do a better job of making sure that those appointments are filled by people in our community. And so I just want to thank you and Walgreens for having many resources available to people to come in there and get vaccinated. So, all right. So a couple of rapid fire questions for you, Dr. Brooks. After vaccination, is it safe to go to the gym or travel?
So I would say, excuse me, as it relates to travel, yes, but you follow still the regular infection control. Going to the gym, again, as I said, if others in the gym have been vaccinated, then you're okay. But obviously, you won't know that. If they're all young, I would say that's good because you're around other people that are at low risk. But you don't know that again. So what I would say is this, honestly, if I went to the gym, I would still wear a mask. You're asking what I would do. Because I would want to protect others from me, and I would try to mitigate or lower my own personal risk.
Second question, should I take pain medication before or after getting vaccinated?
You know, that's a really good question. You can take it before. I would like to know if I'm going to have a reaction as opposed to blunt it before it happens. Because I would, theoretically, I may want to report it. There's a system where you can do through vSafe report things. If you get symptoms afterward, then I would definitely, because the most common symptom is swelling, redness, swelling, and pain in injection site. So if my arm is hurting, I would take a pain medication. Yes.
Okay. Will we need to get COVID vaccine booster shots every year?
Yeah, so we do not know. If I look into my crystal ball, which I will say is cloudy and dusty, I would say yes, because with these variants coming along, what happens is you can, again, as I said, tweak the mRNA vaccine and make it to be responsive or be effective against these variants. So I think it may end up being like the influenza vaccine, where you get one every year around a certain time of the year, and it has a slightly different profile that's based on what you think is the circulating strain at the time. And if that's what we get down to, so be it, because that's what we're doing with influenza. And that's why the death rate is so much lower from flu, because people are getting vaccinated.
Absolutely. Absolutely. So there are quite a few more questions, but I don't think we'll be able to answer them all. There's some more even coming into the comment section. So we're going to continue to have these educational type programs. We're going to continue to put these information out so that all populations, whether you're 50 plus or you're 49 and under, we're going to get this information out to you so you can make an informed decision for yourself and also for your family, so you can share that with your family and friends. But before we go, I want to give everybody the opportunity to make one final statement. We will start with you, Dr. Brooks.
I would say that take this as an opportunity to focus on your own health. There was a question, why are African Americans adversely affected? Social determinants of health, underlying conditions, and racism. So you probably cannot control racism right now. And social determinants of health are somewhat outside of your realm of control if you're in that situation. So take care of yourself. Get your rest, eat properly, take supplements. I personally I think vitamin D has some effect. 80% of African Americans are vitamin D deficient, higher in the winter. And be at peace with yourself. Find your spiritual center and lower your stress levels. That will make you healthier. The virus likes a weak host and it dislikes a strong host. So make yourself strong, make yourself healthy, make yourself whole.
Thank you for that. Mr. Kubia.
So for me, again, those were very poignant words. It's hard to follow that. I'd say, educate yourself. I mean, this pandemic is something that we haven't seen in our lifetimes, and maybe some of us will never see it again. So as you make the right decisions, or as you make decisions for your own health, get as much information as possible, educate yourself, be informed, and make an informed decision that's right for you. I think Edna said it earlier, they're not out here telling you what to do or forcing you to do it, but don't make the decision without the information. So that's what I would add. And I'd say that if you need more information, you can go to walgreens.com/COVID and get as much information on scheduling or the vaccine information. So thank you.
Absolutely. And Ms. Williams.
Well, I will take a slightly different tact, although I certainly agree with what has been said about educating yourselves, and it's been enforced and reinforced a number of times during the last hour. I just want to take a minute to really thank the Black healthcare professionals who have really shown up and supported our community in really in impressive and astounding ways, working with the CDC, developing coalitions, making sure that we have community-led initiatives, working with churches. I've been working in this field for a long time, and I've rarely seen this type of a coalescing among us, recognizing that lives are at stake, that this is shortening. We didn't talk about this, but COVID has actually shortened the lifespan of African Americans in the 2 years that it's been an issue for us. So I really applaud Black doctors, blackdoctor.org, yes, but really I'm talking about the doctors, the MDs who have shown up, recognize that that we listen to them, that they're an important part of our influencer network, that yes, we listen to preachers and we listen to our mothers and our family members, but Black doctors have a rarefied position within the African American community. And I'm so proud really of how they've shown up for our community. And I just want to thank them collectively.
Well, thank you for that. Dr. Brooks is a representative for Black doctors here on this panel. He wants to, he will say thank you for
I
that.
say thank you. I appreciate it. It feels good. Thank you.
Well, I'd like to take a final opportunity to thank all of our guests and panelists this evening for their dedication to combating COVID. We want to thank the AARP for their partnership in bringing this broadcast to our community. We understand that progress has been made, but we still have a way to go. We encourage all to continue to educate yourself and your families with facts about COVID and the vaccines so you can make informed decisions. We at Black Doctor will continue to provide this information through programs like these, our relationship with the Black Coalition Against COVID, and our COVID Resource Center on our website, blackdoctor.org. Until we overcome this pandemic, please continue to stay safe by wearing a mask, washing your hands, and watching your distance. Thank you and good night.